Hello everybody, welcome to another chart interpretation showing the power of horary astrology in medical matters. This chart is a wonderful example of how we can harness the power of horary in order to investigate medical practice. We can also uncover errors in diagnosis. The querent underwent lab tests and the result came back showing a very high level of sugar in her blood. Her doctor promptly put her on a regimen of medications to treat diabetes type 2, metformin and glyburide, the two staple medications to control diabetes type 2. After a few weeks into the treatment, her glucose levels would not come down as expected, and she was feeling very sick. She was not comfortable with the doctor's casual attitude and the fact that he told her she could go on with her normal diet as long as she took the pills. So she decided to do research and learn about the different types of diabetes. She learned that diabetes type 2 is a system-wide inability of the cells to absorb glucose. There is no damage to the pancreas. But in diabetes type 1, the pancreas is compromised and has lost all or partly its ability to produce insulin. Then she concluded she had not been tested properly. So, based on her research, she decided to ask a horary to investigate the integrity of her pancreas. If her pancreas is okay, she is type 2. If not okay, she would be type 1. Let's see how the chart sheds light on her condition. The natural ruler of the pancreas is Venus. It also rules house 5 in the chart, which is the pancreas. It is combust and exalted in Jupiter's sign, the ruler of blood, a clear symbolic picture of high blood glucose. Mars, the ruler of house 6, afflicts the 5th cusp by opposition, which means it is in negative reception by detriment toward Venus. The question is answered. The pancreas is not okay. We have an indication that she may not be diabetic type 2 after all. But let's dig deeper. There is much more in this chart, which will give the querent a rather clear and complete enough picture so that she may make further knowledgeable decisions about her health. Looking at the table of essential dignities, we can see the Mercury is in detriment and fall in Pisces. And it's in house 10, the house of treatment. The essential debilities accurately describe her state of mind and state of health. The house placement describes what she is focused on. As mentioned earlier in the context, she suspects there is a problem with her treatment. The house 10 ruler, Jupiter, signifies the current treatment, the two medications, metformin and glyburide. Jupiter is in its detriment in the sign of Mercury. The treatment is intended to help her, but being essentially debilitated means it has no essential quality. Simply, it is the wrong treatment. Jupiter being in house 12 makes it clear that she is harming herself by following this treatment. The position of the nodes emphasizes the house 6 and 12 connection, that is, a connection between self-undoing and illness. Neptune is conjunct with Mercury, denoting that she is not seeing clearly, which is descriptive. Unintentional as it may be, she is being deceived by being prescribed the wrong medication. Neptune is also on the 10th cusp, tying everything together. She is blinded and the treatment is blinded. It cannot see the illness it's supposed to treat, which corroborates the fact that Jupiter is in detriment. There are multiple clear testimonies that the treatment she is getting is wrong and that the pancreas is not okay. This already answers her question and clarifies what type of diabetes she likely has. But Venus and the Sun are at the end of their sign, so we must look into what the change of signs will entail. That is her prognosis. we have some remarkably descriptive and accurate symbolism here. Venus' combustion in Pisces is significantly mitigated by the fact that Venus has a measure of power over the Sun, as it rules the Sun by exaltation. However, the Sun will move into Aries, and Venus will follow it closely. In Aries, Venus will be in its own detriment, and it will be combust with negative reception from the Sun by detriment. These testimonies indicate that things will get worse for her pancreas, further clarifying that she is diabetic type 1, not type 2, as her doctor wrongly determined. Venus' essentially dignified condition, but combust in Pisces, describes a pancreas that presently still has some capacity to produce insulin. But its movement into its detriment in Aries shows that that capacity will end and she will need to receive injectable insulin. So she went ahead and ordered lab tests on her own. Out of a series of tests, one showed a high level of antibodies in her system, pointing at an autoimmune problem. After discussing it with a specialist, it was determined that she's diabetic type 1, late onset. She's 33 years old. A totally different story from diabetes type 2. The correct treatment for her is insulin, and not the medications that she was prescribed. Let's look at one final point in the chart. Diabetes type 2 is characterized by insulin resistance, meaning that the body's cells become less responsive to the effects of insulin. It is not a pancreas problem. Diabetes type 1 is an autoimmune disorder where the immune system is malfunctioning and destroys the insulin-producing beta cells in the pancreas. In the chart, we can see that Saturn, the natural ruler of the immune system, is peregrine, retrograde, and in house 5, the house of the pancreas. And it is in the detriment of Venus. And since we're talking about the immune system, it's worth mentioning Mars again, because Mars is the ruler of house 6 in this chart. And it's also a natural ruler of the immune system. More specifically, it rules the leukocytes, or white blood cells, the cells that attack pathogens in order to protect the body. It is in negative reception by detriment toward Venus. But there are no pathogens in this case. Mars is attacking the body itself. So we have a very eloquent description of the immune system in this chart. It is a sharp and exact symbolic description of the relationship between the immune system and the pancreas in a diabetic type 1 person. This chart is an amazing example of how Horary can help us in health matters. She changed doctors and was able to get her treatment on the right track.